As you nail down any 4th of July plans for the weekend, health experts are urging people to be wary of a new COVID-19 variant that is spreading. Some think it could lead to a summer wave of the virus. Dr. Ben Newman is a professor and chief virologist at Texas A&M University's Global Health Research Complex. He was part of our team of coronavirus experts during the pandemic. Thank you so much for coming back here to explain this variant to us.
Happy to help. How can I help?
So first of all, what do you know about the latest variant? What is it called, and does it seem to spread maybe a little bit faster than some of the other ones?
Yeah, so to science people, the two new variants that are out there sort of dueling for supremacy are NB181 and XFG. To the citizen virology community, these are Nimbus and Stratus, and I think those are the names you'll hear. They are a lot more catchy than some of the others. Differences seem to be mostly clustered in the spike, which is the thing on the outside and also the thing that we vaccinate against. So it means it's sort of moving a little bit away from our current vaccine. The alarming mutations are that these have developed two new what are called glycosylation sites. It's this sort of fan-shaped sugar molecule that the virus uses to sort of cover itself up. These make it much harder for the antibodies that you have to actually be able to hit this virus. So it's like an extra armored variant of COVID. Symptoms seem to be mostly the same. And about 1 out of every 500 people who are 65 plus that gets this is likely to either end up in the hospital or dead. Those are the current statistics, which are still not great.
Does the old 2020 slow the spread rule still apply? Do we have to stay home away from gatherings? Or do you think that if we, take care of ourselves, we should be able to fend this off?
What kind of patriot would I be to say stay away from gatherings going into July 4th weekend? In terms of what makes the virus spread less, yeah, sure, that would. But if you're outdoors, it may not be such a big deal. I would say the plane to get there is probably where you're going to be cooped up with the most infected people for the longest. And so that's going to be your biggest chance to get that. If you're going in the car with people who are already in your house, there's probably relatively little risk. And I would say enjoy the 4th.
Anything else you can do on your own to lessen the impact of the virus if you do end up getting COVID or you're immunocompromised or have risk factors?
Not really, and you do hear about stuff like this from people that basically don't know what they're doing. Yeah, all those weird tricks to bust COVID, none of those things actually work in a meaningful sense in the lab or in the hospital. No, it's a thing, just like stay away from it if you can. If you don't catch it, it can't hurt you, and the only things that happen when you get COVID are bad. So yeah, no COVID this year, please.
Do the current vaccines work against this variant of the virus? Do the formulas have to change then, like the flu shots, if we keep seeing these mutations?
Well, that's a whole thing because the Secretary of Health and Human Services just recently threw out the entire panel that decides on new vaccines and put in a bunch of kind of anti-vax people. Nevertheless, they had the meeting, the recommendation was made, and Moderna and Pfizer, the two mRNA vaccines, are going to update to something that is basically the major strain that's circulating right now.
All right, Dr. Newman, thank you so much for joining us here at 5 as we try to keep track of all the variants.
Always happy to help.